COVID-19 infections in Europe are back to levels seen in March when the outbreak began. Its peak phase there, that's according to the head of the European Union's Public Health Agency, Andrea Ammon. Ammon said this week's data showed that across Europe there were 46 COVID-19 cases per 100,000 people, putting the continent back to numbers that it has seen in March. But she noted that school reopenings in some European countries did not necessarily pose a new risk. SABC News correspondent Stuart Smith is in London for us. A very good evening to you, Stuart. Thanks indeed for your time. So I guess it's nerves where you are from both parents, teachers and government as thousands of learners in the UK return to school.
Yes, first day of school, a very exciting time for a lot of these children who will have not have seen in person their friends and teachers for 6 months in some cases, and not enjoyed any form of learning, some of them for 3 months. There were, of course, classes on Zoom and other virtual ways of doing it, but for many of these students, back to school properly for the first time, and there's a lot to get used to. There'll be things like one-way systems, screens, and they'll be forbidden from seeing certain other students within the school. A lot of them are in so-called bubbles, which means they must stay with a particular cohort while they're travelling through the school in the same classrooms, use certain corridors. And all political parties in the UK want pupils back at school. They're really glad that this is happening, but there is a debate about whether schools should be paying for all these changes or whether the government should be offering them some cash. The government says it's looking into it.
Stuart, there's also concern about a possible second wave of COVID-19 as some other countries in Europe are experiencing. Is there that concern in the UK at the moment?
Well, the UK is undoubtedly, when you look at the data, suffering from some form of second wave. Since July, the number of infections has been increasing. But what's interesting is there's been no comparable increase in the number of deaths. A few reasons for that, according to the government. Some is that it's simply younger people getting the virus. Other reasons given, such as it's the level of infection is going up, but the number of deaths are not, because medical professionals are better used to handling this virus. But when you look at schools, there's a bit different to other European countries as well. Face coverings are not mandatory for anyone under the age of 11 in primary schools, and in secondary school it's only it's up to the discretion of head teachers whether face coverings should be worn at all. That's different to countries like France, Poland and Russia.
Well, from some of the teachers and parents, I guess, who've been giving commentary to the media there in London, is there any concern from them about, this new normal that I guess both teachers as well as the learners themselves will have to embark on now going forward?
Sorry, could you just say that again? You broke up shortly there.
Sorry, Stuart. I was saying, from what you've been gathering on the ground and perhaps some of the parents and teachers that have spoken to some of the local media there, are they expressing concern about this new normal in which their children are going to have to learn in now?
Yes, so this is the new strategy for the government, is dealing with these any surge in cases by looking at the particular area. So whether that be a school, a hospital, a whole town, you look at the local area to see whether there's an increase in cases. If there is, lock down just that specific place or establishment, trying to avoid any return to national lockdowns like we saw earlier in the year. And indeed, some places have had today to continue those stricter rules. Other places have managed to escape those stricter rules by managing to keep their numbers down. Most of that situated in northern England. Schools there will be looking out for any surge themselves in their own establishments, and if they do spot that, then Public Health England will be able to come in and help them arrange some kind of testing and quarantine system.
SABC News correspondent in London, Stuart Smith, thank you very much indeed for your time this evening.